According to World Cancer Research Fund International, 8 million people were diagnosed with cancer in 2020 worldwide. In Europe, every year, more than 3.7 million people are receiving this terrifying news. Out of all these million people, approximately 50% need radiotherapy, but only 3 out of 4 get access to treatment. Even those who are lucky enough to get access often have to wait more than 5 weeks between diagnosis and treatment. This greatly affects their survival chance. As for cancer patients, time is critical. But what are the reasons for these concerning statistics? First, there is a shortage of well-trained medical staff. Secondly, manual delineation, the bottleneck of radiotherapy treatment, is extremely time-consuming and tedious. More than this, it is a highly subjective procedure, the average disagreement between 2 expert clinicians being around 25%. Radiotherapy is one of the main ways to treat cancer. In radiotherapy treatment, high-energy radiation beams are used to damage and destroy cancerous cells. This is why we need innovation based on modern technology that could bring a vital change to this field. At Synaptiq, we already started working on a solution able to solve all these problems and improve the lives of millions of people. Our AI-based software tackles one of the most important problems in radiotherapy treatment process, which is organs at risk and target volume contouring. And why did we choose artificial intelligence? Because it distinguishes itself from the mainstream technologies by being able to process the data in a sophisticated manner. So in a nutshell, our software impacts on 3 different levels. Firstly, the clinics can save money up to $150,000 per year because the doctors no longer have to do the work. Secondly, now the doctors have, with their extra gain time, they can focus on what matters most, and this is saving more lives. And most importantly, the cancer patients can now get a quicker and more accurate treatment. In the last couple of years, we've been working on the idea, designing the concept and developing the algorithms while building a strong team. At this point, we have integrated the basic technological components. A minimum user interface connected to an inference server hosting the AI algorithms in order to allow the interaction of medical doctors with the software. Steps would be the integration of all these components with the clinical infrastructure of our partners, thus demonstrating the prototype in a fully operational clinical pipeline. On each stage, we will test and review the relevant metrics, get feedback from doctors, and assess a qualitative analysis of the workflow. In the development of our project, we are very happy to receive the strategic support of a prestigious international institution. This year, Innovation Norway offered a non-refundable investment of €158,000, thus helping us to accelerate the development of our technical solution and to start testing and improving its performances in real clinical environments. With the help of artificial intelligence, organs at risk and tumor identification can be done in a fraction of the time with higher accuracy and objectivity. Mediq is the solution aiming to help doctors delineate target volumes, speeding up the process, thus leading to a significant increase of the survival rate. Our already started partnerships allowed us to test and improve the concept together with top-notch medical experts.
Delineating the tumors and organs at risk, which is at the core of radiotherapy treatment planning, is incredibly time-consuming as it performed manually using some semi-automatic tools. Manual delineation is tedious and prone to error process. There is also a lack of medical staff in radiotherapy, which often places more pressure on us to deliver the proper treatment.
To be successful in such an ambitious project, bringing together a highly qualified and passionate team is essential. This is why we constantly study, explore different perspectives, and grow our expertise by attracting the best professionals to join our cause. I was a researcher in a joint project at the German Cancer Research Center and National Center for Tumor Diseases in Heidelberg. I was loving my work, but there was one problem. Our ideas were taking too long to reach industry, to be actually used by someone. But soon I realized that in a startup I could have best of both worlds. I could innovate while bridge the gap between industry and research. First who resonated with this thought was Mihai, back then a researcher at Romanian Institute of Science and Technology. We started working on product development and we did some progress, but we needed someone to focus on business administration, and we needed someone to develop a business plan and also raise capital. With this in mind, Roxana and Diana joined the team and started to work on this project. They were both having masters in business administration and experience in multinational companies. When we finally got our first investment, we decided that we needed to grow our technical team. 3 more people joined our cause, and they had extraordinary experience behind them. They participated in research projects, they worked in internationally known cancer research centers, and they had PhDs in artificial intelligence and machine learning. After this, things really started to get going. At the moment, we are a team of 17 passionate people, including 6 of the best radiation oncologists in Romania. Together, our mission is to empower radiation oncologists to save more lives. This startup is more than just a business for us. Seeing our dear ones facing the shortcomings of the healthcare system gave everyone a powerful intrinsic motivation. Above all, the main reason we are working at this project is not to increase the revenues for the clinics or even make the doctors happier at their workplace. The main reason we are spending our time is to give time to those who are unfortunate enough to be diagnosed with cancer.